Afghanistan has been devastated by war, and they are struggling with poverty economically, and they have big struggles, and that affects the women, especially the women and the children, of course. And that would be another reason and a cause for a woman to decide to burn herself. This issue of a lack of awareness about rights is a difficult issue because even if women are aware of their rights, is there anybody being able to hold their rights accountable? Is anybody saying, well, you do have a right to divorce your husband and to leave, and you will not be hurt or nothing will happen to you? There's no real accountability yet for that. It's starting, but it's not yet at a good enough level. And so they do need to be aware of their rights, though. And not being aware makes them think that the only solution for my problems is to burn myself and to make this protest through my actions. Of course, illiteracy and the lack of education is also a major cause, and just not knowing that there is another way. And so some organizations are heavily involved in raising awareness and education and building schools and enabling women and girls to be educated and to learn about their rights, and just the power you have from self-education, from knowing. Let's move on to self-immolation projects and what is happening in Herat right now and who is working on what. So there are prevention and intervention campaigns currently happening. Unfortunately, because of funding, a lot of these programs yet are not at an annual, year-long state. Oftentimes they're 1 month or 2 months or a couple months in the year, but we need to work for them to be year-long so that everyone can be hearing and everyone can be learning. We can raise the issue. There is a burn unit that was built. And so I mentioned earlier this little burn unit the size of a bathroom. Now there's a full hospital that is devoted entirely to burn care, and this was done with USAID funding through a French organization called Humanitaire. And they have 2 operation units that do skin grafts, and that is really the pride of Herat, and this is the best burn center throughout the whole country of Afghanistan. Some NGOs are working on following and tracking and reporting the self-immolation incidents to get an understanding of where this is happening. Reporting is a big issue. It's hard to even know how many cases are happening. When I went to Afghanistan this spring, I arrived and I visited the hospital. They said that so far in the 2 months of the year 2010, they had had 18 cases. And they said compared to last year, at the same time, they'd only had 8 cases. So a major increase, and what's caused that increase? But like I said, there's no way to really know how many cases are happening because a lot of the self-immolation incidents are happening in more rural settings in the villages where they might not have opportunity to bring their daughter, or they might not want to bring their daughter-in-law to the hospital. Some NGOs are working on promoting and protecting women's rights. We've got NGOs doing research and clinics that provide mental health counseling. And so for the women who do survive, they have the opportunity to receive counseling, and a lot of them are suffering from PTSD. There's a psychosocial counselor who goes to the burn unit and speaks to these women while they're in the hospital bed, and she talks with them and tries to get through what just happened and process what's going on. Another NGO is doing vocational training, so training these self-immolation survivors to live by sewing and different skills. Really quick, I just want to address what the needs are. And this was really, I was very excited to hear what my informants had to say about this, because this is the future here. So there's a need for more prevention and intervention campaigns, more job opportunities for women. If we can give them jobs and raise their economic status, that will improve their well-being. Raise awareness, of course. Again, that's tricky because when you raise awareness, you also want to raise accountability. this idea of enforcing a marriage recording system I thought was very interesting, to enforce that the legal age is 16, and if you marry your daughter before 16, there will be penalties, and you will have to pay a fine, or you will have to go to jail or something, some kind of accountability for that. And of course we want to improve the judicial system and increase the government support, that this issue needs to be out and they need to discuss it and address it. So this picture I took in the mountains of Afghanistan of 3 boys who were running along with their wood behind their back, and I said to them, I said, could I take your picture? And they said okay, and they gave me this, this picture. And I said to them, well, how about a smile? And they said, okay. And this was the next picture. And I put this up because I feel this is how Afghanistan is in my heart, that on the outside they've been through a lot, and yes, they've lived through many things that have maybe caused difficulties, many difficulties, but when you see and when you get to know them, they are a great and beautiful people. Lastly, I just would like to acknowledge my father, who has been working in Afghanistan since 2003, and without his help I could not have done this research. He was crucial in setting up connections and getting things done. And of course to UCSF, my university, for enabling me and allowing me to do this research in Herat as one of the first studies ever done around this issue, specifically in Herat. And Dr. Ziegler, who is the director for the Global Health Masters, and who was a little reluctant at first to let one of his students go to Afghanistan. But I'm so happy that he let me go and open that door. And finally, to my mentor and PI, Dr. Rutherford. And thank you for listening.